Now let's talk about pulling a client up in bed. This is really useful to help make sure a patient's comfortable, or maybe their head of bed is at the highest part of the bed so they can breathe more comfortably. So before you get started, make sure you get help here. You do not want to pull a client up in bed, obviously by yourself. So make sure you request assistance. Now this is important because we want to position the bed at the proper working height. Now remember, you're going to have a partner here, so maybe if it's someone shorter like me and someone much taller, we have to have an agreeable height and a safe working height that both of us can work from. So make sure you look at that. Now if able, you want to put a slide sheet or a draw sheet underneath the patient. This is going to be much more helpful to move the patient up in bed. It's also going to limit friction, which can really tear down their skin. Now, if able, use the bed itself to help you move up the client. So if you think about if this is the head of the bed and you tilt the patient down a little bit, this will definitely help move the patient up. So don't be afraid to use your bed settings to help you out a little bit. Now at this point, grasp the side of the sheet or the draw sheet at the client's upper back and hips. So when we grasp the sheet, make sure you're not at the edge of the sheet. Make sure you grasp it really close to the patient's body. This is going to be much easier to help move the patient up in bed. Now this is really important. Anytime we move a patient, make sure you put 1 foot towards the area that you're going to go, such as 1 foot pointing towards the head of the bed, because we're going to be going this way. So that's really important. That way you stay safe and you're using more of your legs and you're not going to be tipping over this way. Now on the count of 3, shift your weight to the front leg, which is where we're going to be going, and pull the sheet towards the head of the bed. Okay, so before we move this point, counting to 3. This whole count thing's really important because what if your partner doesn't know if we're moving on 3? Is it after 3? So make sure you communicate here to make sure you guys are on the same page before you move the patient. So now that the patient's comfortable, we can reposition the bed to the lowest position for safety. Don't forget, since we're leaving the bed, remember to put those side rails up. Now we can perform hand hygiene and document the procedure. Hi, welcome to pulling a patient up in bed. So this is going to be particularly helpful when maybe your patient's been weak or they've just had surgery or they're not able to do so for themselves. So sometimes your patients can use their legs, help push them up higher up in the bed, but if they're not able to do so, we as staff can assist. So we're going to show you how to pull a client up in bed. So before we start, you definitely are going to have more than one person, right? Because you need one on one side and a person on the other side. So make sure you get help. Now before we get too far, you want to make sure the bed is up in a great working height for both you and your partner. Now, here's the tricky part. As you can see, me and Dean are definitely different in heights, right? So make sure it's going to be something comfortable for me as a shorter staff member and also Dean. So unfortunately, my taller partner here will probably have to squat a little bit more when he moves, and we'll talk about that as well. So get on an agreeable, comfortable working height. Then, because me and Dean are both on each side of the bed, we can put the side rail down. And don't forget that anytime you put down a side rail, someone should be on the other side of that side rail. So just make sure no side rail means staff should be there. Okay, so now we're going to put these down. Okay. Thank you, Dean. So now when we pull a patient up in bed, one thing I want you to keep in mind is body mechanics. So I'm going to face Dean. We're also going to have to make sure we communicate about when we want to move the patient up in bed. So we've got to decide this before we decide when we're going to move the patient. Okay, so Dean, how about we count on 1, 2, and on 3, we move the patient. Does that sound good?
Sounds great.
Okay, perfect. So we've made a plan before we move the patient. So now one thing I want you to notice is our body mechanics. We're in the trunk of the patient, which is the heaviest part. The other thing is we're facing each other. One thing to note is I'm facing this way, but my right leg in the direction we're going is going to be pointed this way. So what I mean by that is I'm here, my legs pointed towards the top of the bed, and we're going to be moving together like this. So that's really important. That's why communication is key before you move a patient up in the bed. Also, if we're not careful and we don't communicate, we can sometimes shear the patient's skin if you don't communicate. So make sure you make a plan before you do so. Okay, so now that we're ready, me and Dean has made a plan. We're going to position our body, and it's always recommended that if the patient's a little bit heavier or anytime you're going to move, make sure you are not straight up and use a little bit of bend in your knees and then move together and use your legs. So our patient has a draw sheet underneath there. I'm going to fold this back so you can see this a little bit. This is really helpful. It's a white sheet underneath the patient. Now, typically when we make a bed, we place that here for this specific reason or to move the patient. So when we use the draw sheet on a patient and when you move a patient up in bed, you really don't want to grab the outer portion of the draw sheet. Now, the reason why, if you watch, it's much more effort to pull from here than it is to choke up on the draw sheet and get it really close to the trunk of the patient where the heaviest part is and move that way. Now, we've made a plan, but we're going to reconfirm that plan before we move the patient. Okay, so Dean, when you're ready, on 3, we'll say 1, 2, and then on 3, we'll move the patient. Does that sound good?
Sounds great.
Okay, great. So now we're going to take our draw sheet, and as you notice, you can either tuck in whatever works well for you, but get a hold of that draw sheet closest to the trunk of the patient. So now I've got that, and notice me and Dean's body mechanics. We're facing each other, but it's really important that you take your foot the way that the lead foot and go point it towards the top of the bed because that's where we're going. So when I'm here, I'm going to have my foot pointing this way, and we're going this way with the patient. That way it gives me the maximum stability. Okay, so now I'm going to grab my draw sheet, and on 3, me and Dean are going to move the patient. Ready? 1, 2, 3. Thank you. And then we're going to make sure the patient's linens are where they need to be, the patient's in a comfortable position. Then we're going to make sure the bed is in the lowest height, the side rails are back up, and perform our hand hygiene before we leave the room.